I want to tell you about Shalon Irving. Shalon is who I would call a superstar. She was a lieutenant commander for the U.S. Public Health Service Commission Corps and an epidemiologist for the Center for Disease Control and Prevention, the CDC. She earned 2 master's degrees and a double PhD. As a Harvard and Georgetown trained obstetrician and gynecologist, I would have welcomed the opportunity to work with her. But Shalon also had a dream of becoming a mother, a dream that, despite many odds, came true. And after a risky pregnancy, she had a safe cesarean delivery of a beautiful baby girl, Soleil. About a week after she went home, Shalon developed a small wound complication. It was missed by the first physician she saw, but identified by another who treated it well. Afterwards, Shalon continued to feel sick and was seen by medical professionals 4 times. On 2 of those occasions, her blood pressures were so high that, according to the American College of Obstetricians and Gynecologists, they should have been treated with urgent hypertensive therapy. They weren't. On her last attempt to get help, a nurse practitioner sent her home with a prescription for blood pressure medicine and said, "There's nothing we can do. You just have to wait. Give it more time." The only time she got was 5 more hours that evening and 4 days on life support. She was only 36 years old. An autopsy reveals complications of hypertension. Her family experienced a nightmare that they will never wake up from. A nightmare that approximately 700 families experience in the US every year. A nightmare that disproportionately affects the families of African American women, who are approximately 3 times more likely to have maternal deaths than Caucasian American women. An African American woman is more likely to have a maternal death here in the US than a woman in Mexico. Perhaps the worst part is that, according to a report written in collaboration with the CDC, more than 60% of those deaths are preventable. That means at least 420 families did not have to experience that tragedy. More American moms are dying of pregnancy-related complications than in almost any developed country in the world. We are the only developed country in the world where the maternal mortality rate has been rising. Clearly, we have a problem with moms dying in the US. Shalon's story can help us understand what's happening. I mentioned that Shalon had a risky pregnancy. One reason is that she had a genetic disorder that made her more prone to developing life-threatening blood clots in her body, including her lungs. Her condition is actually more prevalent in women with European ancestry. The other is uterine fibroids. Fibroids are more common in Black women, but are common in white women too. It was the reason she needed a cesarean section. C-sections are linked to higher complications in moms, and their rates have been rising in the US over the years. This has been blamed as part of the reason for increased maternal deaths. Shalon also had high blood pressure or hypertension, something many of us know about. Hypertension is affected by lifestyle factors, but there's another factor that affects African American women. The chronic stress that an African American woman feels because of race-based discrimination leads to a condition described by Professor Arlene Geronimus as weathering, a wear and tear on her body that increases her risk of developing illnesses like hypertension and diabetes at an earlier age than a white woman. Even on a genetic level, it adds an average of 7.5 years to her chronological age. A weathering so profound that, like Shalon, her wealth and education cannot protect her from it. So profound that it helps to explain why an African American woman has worse health, gives birth to sicker babies, and has babies who are more likely to die than an otherwise similar Black immigrant woman from Africa or the Caribbean, where I grew up. To add insult to injury, African American women are more likely to experience disparities in access to quality education, safe housing, healthcare resources, employment, and live in unsafe environmental conditions. Then there is implicit bias. Implicit or unconscious bias can be present even in the most well-meaning of individuals, regardless of their race, and leads them to have negative assumptions about someone because of that person's race, and can lead to substandard care. This type of bias has led to substandard care for African American women all across America. So the question is, when Shalon received medical attention at least 5 times before she died, and the many times was given what experienced OBGYNs would consider substandard care, was it race-based discrimination or a deficiency of skills of some of the multiple caregivers she sought, or some of both? I have read and reread Shalon's story over and over again, and despite my almost 20 years of experience as an OBGYN, I still cannot understand why her death was not prevented. Yes, pregnancy can be dangerous, and I'm under no illusion that it isn't, or that even with the best of our efforts, we can still lose some of our moms. But we must do better. We can do better with programs like in California that have established toolkits that provide detailed explanations of some of the major health risks in pregnancies, real-life examples, and step-by-step evidence-based guidelines to help hospitals to prepare for and address the problems. These toolkits have aided in California's 55% decline in their maternal mortality rate between 2006 and 2013. But even in California, African American moms still die at a rate, their maternal mortality rate is still approximately 3 to 4 times that of Caucasian American mom. So we need to do better. We can add programs like one of those in North Carolina. For example, the Pregnancy Medical Home, which has helped that state eliminate the racial disparity in its maternal mortality rates to a rate of 24 per 100,000 for both Black and white women in 2013, from a rate that has been as high as 59.4 per 100,000 for Black women in 2003. They have incentivized medical providers to do risk screening for pregnant Medicaid patients, to complete their postpartum visit, and if a mom is found to be high risk, she gets a pregnancy care manager who helps her understand the problems and stick to the steps to keep healthier. Why don't we integrate these 2 programs and apply it to all the states across America? But let's go even further, because our rates can be even better. Let's provide pregnant women with supportive doulas, trained professionals who provide physical, emotional, and informational support during pregnancy, labor, birth, and the immediate postpartum period. mothers with doulas are 4 times less likely to have a low birth weight baby and 2 times less likely to have a birth complication involving either themselves or their baby. But medicine is a practice. And if we as medical professionals practice substandard care for some of our patients, we're more likely to offer substandard care to all of our patients. We need to ensure that all healthcare professionals who deliver obstetric care are properly versed in the complications of pregnancy and the postpartum and are trained to counteract implicit bias. This care should be held to the highest standards, and we should make sure patients feel they're well cared for with patient satisfaction surveys. We need your help too, because the sicker that our moms are when they become pregnant, or the sicker they are when they come to the hospital to have a baby, the harder it is for them to be saved. If you are or you plan to become pregnant, take care of yourself. Choose to avoid drugs and alcohol. Eat healthy foods. Exercise. Sleep. Maintain healthy relationships. And actively engage in stress reduction exercises. If it's your sister, wife, mother, daughter, support them in their efforts to stay healthy. We can advocate for disadvantaged women to have resources so they can access healthy foods, a safe place to live, a safe place to walk, and education so that they can break the cycle of poverty for themselves and their children. I wish Shalon had the antihypertensive therapy she needed. I wish Shalay had her mummy, but wishing won't bring her back. In the United States of America, we can eliminate racial disparities and have the lowest maternal mortality rate in the world. It's not going to be easy. Frankly, it's going to be hard. But America's not afraid to do something just because it is hard. Before we went to the moon, Kennedy said, "We choose to go to the moon not because it is easy, but because it is hard." This could be the challenge of our decade, but for the lives of our mothers, this is a challenge we need to win. As an obstetrician in Baltimore and a mom, I am committed to do all I can to ensure that Shalon and none of our moms have died in vain. I hope you will help me. Thank you.